I've been seeing a lot of ads recently about bite splints, and that's really not surprising considering that dentists have noticed a definite increase in grinding and jaw pain that's associated with the COVID-19 pandemic. So we've all had a little bit of stress and anxiety that's occurred. I've actually had members of my own family who have fractured their teeth during this time, so that's really not surprising. My name's Dr. Scheurer, and I'm here at Tranquil Dental. I want to know if there's any subject matter related to dentistry that you would like to know more about. I'd be happy to cover it, so comment down below. Comment if there's something of interest you'd like me to review, but also if you're finding benefit in this, I would appreciate hearing that. So people have been grinding their teeth for many years, for decades, and the reason for grinding is associated with stress and anger and pain and anxiety. Sometimes it's associated with an abnormal bite, so either missing teeth or crooked teeth, teeth that aren't fitting together properly. That can all cause grinding and or clenching. And so clenching is when you're just biting straight down with force, and grinding means that there's movement to the teeth. And sometimes that's done during the day, and sometimes it's done at night. There are a lot of problems that can occur from grinding. So if you're grinding your teeth or bruxing them, as we call it, at night, you can have resultant headaches or jaw pain. I had a patient actually in this week who had said that a number of teeth on the bottom and the top were sore, that she had pain in her jaw, and actually it came down right underneath her jaw. So from her ear down to right below her jaw. And that's absolutely a function of grinding. That's a muscle that inserts down here at the bottom of the jaw and comes from up higher, and then your jaw joint, of course, is right in front of your ear. So that's definitely all related there. But grinding or bruxing can cause headaches, jaw pain in the joint or in the jaw, and it can cause worn down teeth and cracked teeth or broken teeth, as we were talking about before. So there are many ways to try to address the grinding, the bruxing. Certainly if there's a lot of stress or anxiety in your life, you can try some relaxing techniques, maybe reading a book or listening to some music or taking a walk, having a bath or a warm shower. You can also seek out help with regards to maybe having some counseling to help to learn how to handle that stress. But another treatment that you could seek would be to have an occlusal guard. Let me back up 1 minute. So we talked about that teeth might be malaligned, that they might be crooked or not hitting properly, so that your bite might be off. And certainly correcting that bite would be one of the most important things. But if that's not the issue, then an occlusal guard is something that you could definitely benefit from. This is an occlusal guard, and it fits on your teeth precisely. We take impressions or scans, and then the occlusal guard is fabricated to fit on all of the top teeth. So when you take that off, then you can see that it's kind of a U-shaped structure, and your top teeth will fit in there. It goes up the top teeth maybe half, 3/4 of the way. Kind of varies depending upon the specific situation, the teeth that you have and the positioning and so forth. But it has a flat plane against it. So it's really important that it be hard. Usually I knock on a countertop like that. If you have something that's really soft, that can cause a lot of problems with regards to your joint. I tell my patients that it's like I gave you a stick of gum and told you not to chew it. It's a little hard not to chew it. It's something that's going to come naturally. And especially if you're sleeping, you're going to gnaw on that. And as you're gnawing, that's going to cause jaw trauma. They say that the force that can be put, they've measured it, the force that can be put subconsciously while you're sleeping on your teeth can be up to 250 pounds. So that's huge. There are lots of different devices that can be worn. We have athletic mouth guards that can be made. They're thick and kind of rubbery, and you can have them fabricated at the dental office, but you can also get them from the drugstore or the sporting goods store, where you can, they're called boil and bites. And so you can boil it and bite into it, and it's soft and it's protective. But again, that's soft. And so that is something that will encourage that chewing, that clenching, and that can cause a lot of problems with the muscle and the joint. So you really want it to be of a hard material. That having been said, you also need for it to relate to those bottom teeth in a very specific way. So I do know that there are some that are over the counter, or I've been seeing these advertisements about the fact that you can just send away to get an occlusal guard. But really, it's very important that not only fits those top teeth precisely, but that your bottom teeth are relating to that occlusal guard the right way. And so how that's done is that if you are biting on your back teeth, you can put a lot of force on those back teeth. But if you bring your front teeth together and try to bite, you just can't bite quite as hard on those front teeth. And that's a protective mechanism that we all have. And so we take advantage of that when we fabricate an occlusal guard. And it's not just in the fabrication of it. You need the dentist to be making those adjustments to make sure that you are grinding on the right teeth. So let me back up. An occlusal guard will do a number of different things for you. The first is that it literally will protect your teeth from the grinding, from the stress of that will cause the cracks and the breaks and things like that. So it will protect those teeth. But what you really want is to decrease the grinding that you're doing. And that's where it's important that it be adjusted properly, so that you're just gliding on your canines as you're going from side to side. So we only want certain teeth hitting when you're going from side to side, because that's the part that decreases the grinding. So certainly there's a lot of stress going on a normal, everyday year. But given the last year that we've had, there's additional stress that we're all going through. So definitely try to find some ways to unwind yourself from that stress. But if you're noticing that you're grinding your teeth, or that your teeth are getting worn down or cracked or chipped or breaking, then you definitely could benefit from an occlusal guard. And a lot of times you're not really aware that you're doing that grinding. Patients sometimes will say to me that they're not grinding in their sleep, but I can see that their teeth are worn down in a certain specific way, so I know that they're grinding. And I say to them that I would tell you that I don't grind my teeth, but I've actually worn an occlusal guard for, well, let's just say many, many years. But I would tell you that I don't wake up with headaches. My jaw doesn't hurt. My husband doesn't hear me grinding my teeth in the middle of the night. But thankfully, I've got an occlusal guard in there to both decrease the grinding that I'm doing, but additionally to protect those teeth.